And welcome back to the Wellness Paradox podcast. I'm so grateful you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena that I call the wellness paradox. This paradox, as I view it, is the lack of integration of wellness and fitness professionals into our healthcare delivery system. This podcast is all about closing off that paradox by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in today's episode, we're joined by Laurie Whitsel of the Physical Activity Alliance. This episode is going to be a little bit different for many of you that are listening because we're going to start to talk about public policy and advocacy. Often as fitness and wellness professionals, we tend to think on the micro level in terms of what we can address. The individual person or persons that we're working with, the people in our gyms, in our group classes, in our fitness or wellness centers. And while that bottom-up approach is absolutely critical to addressing the health issues in our country, there also needs to be a top-down approach based on policy and based on infrastructure. And that's exactly what the Physical Activity Alliance does. As Laurie will talk about, there are several organizations that collaborate together to become the Physical Activity Alliance. And their job is primarily advocacy at the federal level in Washington, D.C., to put legislation in place that makes activity the easy choice and inactivity the harder choice. This conversation really gets into the discussion of being products of our environment. And many of us don't always think about it, but depending on the community you live in, being physically active may be the difficult choice. You may not have curb cuts on the sidewalks to be able to ride a bike or walk properly. There may not be sidewalks at all. There may not be street lights to walk at night. Communities may not be safe to walk in. There may not be parks and green spaces. There's a whole host of public policy decisions that go into how active or inactive a community is. And the Physical Activity Alliance is advocating and fighting vigorously to make communities more activity friendly. And that's what Laurie and I are going to talk about in a little bit greater detail on this episode. I really hope it opens your eyes and opens your minds to a new lever that we can pull to address the physical activity crisis in our country. And I also hope it gets you to realize that each one of you listening can be an advocate. You can talk to your state representatives. You can talk to your local representatives. The more we can get on the political radar of policymakers, the more we can work with local public health departments, regional public health departments, and even groups such as the CDC at the national level and the World Health Organization on a much broader scale. We can develop top-down policies that start to make activity the easy choice and inactivity the more difficult choice. Clearly, the obesity and inactivity epidemic in our country is something that requires both a bottom-up and a top-down approach. This podcast is going to address a little bit more of the top-down approach. I really hope you enjoy this conversation. I hope you find it informative. I hope you find it as a vehicle to find your voice for advocacy at the local, state, and the federal level. Any additional information we'd like to share from this episode can be found on the Wellness Paradox website on the show notes page at wellnessparadoxpod.com/episode 16. I hope you enjoy this conversation with Dr. Laurie Whitsel. We're here with Laurie Whitsel from the Physical Activity Alliance. We're super excited to have this conversation. Laurie, thank you for joining us today.
Thanks, Michael. It's great to be here.
Awesome. Well, I want to get right into it because there's a lot of stuff that we want to talk about today regarding the Physical Activity Alliance. I think for starters, it would be really helpful for everyone to know a little bit more about you and your background a bit more, because it's more than just working for the Physical Activity Alliance. So why don't you tell us a little bit about your background?
Sure. Thanks, Michael. So I am currently the Vice President of Policy Research for the American Heart Association. I've been doing that I've been with the American Heart Association now for almost 20 years in different roles. And I'm in my current role for about 4 years. But, I really sit in that spot translating science and evidence into impactful policy that we hope will make a difference in people's lives. And so I love the work that I do. Before, when I was doing my PhD work at Syracuse, I worked in cardiac rehabilitation. So I had a chance to see firsthand there and gain an appreciation for the work to help people regain their activities of daily living. And I've always, been involved with physical activity and sports in some way. Before I went for my PhD, I coached at the college level and had the chance to work with the women's national soccer team. And that was a great opportunity and a lot of fun. And then, as a volunteer now, I still coach youth and kids because I just am a strong believer that we need to give kids as many physical activity opportunities as we can. So I've been doing that. And, it's just been a great opportunity to be connected to the physical activity community in so many different ways, but exciting with the work that we're doing now with the Physical Activity Alliance.
Yeah, absolutely. This is going to be a very interesting discussion because this is going to be largely a policy-based discussion, which I think a lot of people out there listening, I think COVID has really underscored the importance of policy making. But I think a lot of people, when they think physical activity interventions, think the personal trainer in the gym or the coach working with the athletes. But, as I sit here and give this interview, for those of you that are listening and not watching this on video, I'm looking at the Capitol Rotunda in the background as you talk. And, clearly a lot of the changes that need to happen to our healthcare ecosystem need to happen on the policy level. And that's the exciting thing about the Physical Activity Alliance is it's this new collaboration that's focusing on how we address things at the policy level. So tell us a little bit more about the driving force behind the creation of this organization and what it's set out to achieve.
Yeah, I'm so excited to tell you about it. We really came together in Washington, D.C. about 2 years ago now to talk with the physical activity community, some of the key leaders in the physical activity community about us coming together and uniting more in our work around policy, systems, environment change. And there was a lot of excitement in the room to try to make that happen. And so a smaller group met literally weekly for the next year to try to bring together some existing organizations and create that collaborative, that alliance that unites us in our work. And so it was the National Physical Activity Plan Alliance, the National Physical Activity Society, and the National Coalition for Promoting Physical Activity. Those were the original organizations that came together to form the alliance. But what we really hope, Michael, is that we are now a big umbrella and we want to be as inclusive as possible. We have 12 organizations that have committed to leadership of the alliance and are, paying members and are on the board and helping the strategic, helping determine the strategic direction of the alliance. We have so many individuals and other organizations involved in the committees of the National Physical Activity Plan, in the professional development work, and in the policy committee. So we're all about trying to bring everybody together. And as you say, it's that policy and systems change that I think is going to really make a big difference. And that's what we're trying to affect at the Alliance.
Yeah, and it's interesting to hear you, and I've read on the Physical Activity Alliance, that's how I've come to connect with you. And it's interesting as you talk about those different organizations that are involved and you listen to their names and you look at their acronyms, you start to see that, wow, these are all very similar organizations aiming for the same goal, but probably doing it in a somewhat siloed or maybe disconnected fashion. So what have you noticed in the early stages of this as these groups start to come together and collaborate? What do you notice is the work product of that? What are you guys actually seeing in terms of some of your tangible accomplishments early on?
Oh, well, that's, so many actually. It's, first of all, when you bring that many organizations together and the in-kind support that they're providing to make the Alliance successful, it just amplifies everything. So just incredibly grateful for the time, resources, contributions that every member of our board makes. And so we've had our first congressional briefing where we outlined to Congress the priorities that we have in physical activity. We have unveiled, we worked with a consulting firm to develop a roadmap for standardizing physical activity across electronic health records and healthcare delivery. We are developing a certificate program for public health practitioners and public health professionals to enhance their knowledge and understanding of physical activity. And this is just a short, and then of course, all the work that we're doing in the National Physical Activity Plan underneath each of the sectors, whether it's trying to improve physical activity surveillance. We've got a number of projects working that are happening in that space. We've developed some recent white papers that we'll be releasing soon on the importance of physical activity post-COVID, especially for youth. So there's just, it's incredible just in a less than a year's time, really, the amount of work we've been able to do. And to do this with so much teamwork and, everybody seems to be excited about the progress we're making. And it's nice to be able to point to these specific accomplishments to keep people energized and moving forward.
Yeah, absolutely. That is a tremendous list, and I realize it's not an exhaustive list in only a year, and a year where it's been difficult to get things done just simply because of distance and complexity with COVID and everything. And it's not surprising because I know of all the organizations that are involved and how strongly they advocate for this. It's exciting to hear that now there's a centralized body that's really trying to leverage the synergies that exist. You said something that interested me because we've talked to Mark Stottenberg on the podcast on ACSM's Exercise as Medicine initiative, and you mentioned the standardizing of physical activity measurement inside of electronic health record systems. And I don't know how much you can get into this, but is that similar to the EIM physical activity vital sign, or like what are you guys looking to do in that domain?
Great question. And so Mark has been a wonderful, powerful partner in this work, along with ACSM and Exercise as Medicine. I just finished a paper together that talked about kind of how this should be within healthcare delivery, what this could look like, who should be delivering the prescription, how the referral happens, and the vital sign itself. So it actually, there's so much swirling in this space right now, but it goes back to, so a couple things. First of all, American College of Sports Medicine has done a lot of great work in establishing that vital sign, validating it, testing its reliability with its partners across the country. But what we do need to do is try to embed that within the electronic health record and then foster uptake of use of that measure. And so I've learned a lot in kind of talking to those who are in this space of measurement, developing these kinds of measures, and realized quickly that we needed to engage with an expert firm that is in the HL7 process all the time. This gets very wonky very quickly. And so they helped us create a roadmap and a budget for doing this work. And this work is kind of the foundation. Like if you're gonna make this happen in healthcare delivery, first you need the measure itself in the EHR, but then you've got to train and educate physicians and get their buy-in, and other health professionals get their buy-in to use this measure, and then find the full continuum, healthcare continuum of prescription, referral, and then some feedback to the healthcare professional to see what's happened. So we also are talking with the CDC very often. They're, a great we have a great relationship with the Department of Health and Human Services and CDC, and that they're in the process of this data modernization and surveillance work as a result of COVID. They received over $500 million to do this from Congress in the stimulus bills. And it's going to be critical. One of the major superhighways into this surveillance upgrade is the electronic health record. So as physical activity isn't there, we're going to miss out on a tremendous opportunity to improve our surveillance across the United States. And so that's another reason for this work. It is first and foremost about patient care, but it's also because we want to be linked to surveillance data modernization.
Yeah, absolutely. And it's so exciting. And just for people listening that may not know the nuance of what we're talking about here, when we say surveillance and physical activity vital sign, we're literally saying a vital sign like any other vital, your heart rate, your blood pressure, your weight. This is the physician or charge nurse asks you how many days a week you're physically active for how many minutes, and compares it against our standard of 150 minutes of physical activity per week to see if you're meeting that guideline. And if not, it gives the physician the opportunity or healthcare provider the opportunity to intervene with some type of brief conversation. And then to your point, Laurie, then effectively refer that person to a physical activity resource and then somehow get feedback into the system that provides the physician some information on how effective that intervention has been. And as fundamental as this sounds to you and I, and maybe many of the people who are listening to this podcast, it becomes exceedingly hard to do that in a 10 to 15 minute appointment in an office with a healthcare provider. And I think you hit the nail right on the head. It could be in there, but physician and healthcare provider uptake is so critical. But that's only the second step. Then it's getting it to be used effectively and get information back in. But I think what you said that I really want to point out that seems to be a very important piece of the advocacy work that's happening right now is that because of all the data modernization that is happening, this massive sum of money that's going into it, that if we don't get in now with this, we really have the chance of missing out for a very long period of time, because this is a very bureaucratic and complex process.
It's a very long, arduous process. And I don't want to insinuate that this is going to happen overnight. This is multi-year, all hands on deck. And it's a multi-pronged effort too. So the HL7 process, the standardization process, is just one piece. There's also the conversation with the American Medical Association on CPT codes so that, professionals can use those for reimbursement of physical activity counseling. And then the conversations with CMS on coverage, who's going to be covered in offering these services, and with NCQA on performance and quality measures. So, it's a long, arduous effort. Most of it's in the regulatory environment, but we're ready to engage and work together to try to make a lot of these things happen.
Yeah, and you bring up...
it should be, as you say, Michael, a standard of practice for the healthcare professional to have this conversation with their patients. And they've got to feel comfortable having that conversation. A lot of them don't have the background to feel comfortable doing that. So part of this is also professional education and patient education. So that's why this collaborative alliance effort to do this together is so important, because it's going to take a lot of, all of us to try to, make progress down this road.
Yeah, when you hear it on its most simplistic level, like, oh, okay, just put it in the system and then they'll ask the question. And then, you start to really think of all the complexity. You brought up something that I want to touch on. And this is a fascinating area. I've got so many questions I want to ask on it. I'm gonna try to be somewhat succinct to make sure we get through everything. But the reimbursement aspect is always such a complex issue as well. And we know all the complexity with our health insurance system in this country. But what's your sense as someone that's involved on the front lines of this, of how effectively we're moving towards some degree of reimbursement or CPT codes for this in the electronic health record system? Where are we on that journey?
Well, so I think a couple of things. First, as you know, anything that is characterized as a level A or B recommendation by the United States Preventive Services Task Force is supposed to be covered by health insurance plans in the United States at little or no cost to patients. And lifestyle behavioral counseling for both physical activity and nutrition or diet is covered for those with at least one cardiovascular risk factor at a level B recommendation, I believe it is. So there should be coverage. The question is who offers that counseling. And right now, registered dietitians are positioned to be paid for that. Of course, doctors, nurses, licensed professionals. And so I think the question is also, can other professionals be positioned for that reimbursement? I think that's an area that we need to spend some time working on with CMS. And it's, there's a lot of work to be done there. I think, first of all, even defining for CMS who those professionals are and why and how they should be reimbursed. So that's a big lift, but something that we're certainly, trying to address. And so I think, it's along the whole continuum of care. And, what CMS does, the individual market generally follows. And so that's why working with CMS is so important.
Yeah, and for those who may not know the acronym, that's Center for Medicare and Medicaid Services. That's the government funded arm of the insurance. I know my head spins sometimes with all the acronyms that end up in the healthcare.
I know, and absolutely. And please catch me, because I do it all the time, and I need to stop throwing around all those acronyms. So please catch me when I do that.
No worries. No, I always like to touch base with somebody that is sitting out there trying to figure out. They're Googling this as they're listening. I think what you said there is so interesting about who else could get reimbursed. Because one thing I've always been struck by, and I'm curious to get your thoughts, any barrier to physical activity can be a deal breaker for many people. Have that be the safety of their neighborhoods, no sidewalks, poor street lighting, whatever it might be. But also proximity to physical activity resources make a difference. And I think something that might be implicit to what you're saying is that, hey, yes, we have a bunch of providers that can do this, but we need a lot more if we're going to address this with a critical mass at scale. And is that the thought of why we want to see if we can get other professionals involved in this, maybe exercise physiologists or maybe even personal trainers if they met a certain credentialing level or something like that?
That's exactly right. And thanks for bringing that up. Right now, the demand, the number of people who could benefit from this counseling, we need more professionals to be able to deliver that counseling. The other thing, Michael, is there's a little more appetite at CMS and with health insurance plans to cover programs versus individual professionals in offering these, whether it's the diabetes prevention program or silver sneakers. And that's where they seem to be right now. And so I think we have some work to do in terms of further positioning those programs, but also further positioning professionals. And as you say, I think we also need to try to connect clinicians with the resources in the community that they can refer their patients to, whether it's the local Y, health and fitness clubs, parks, recreational spaces, and programs, other programs that are available. And so that connection is really important too. And we have to think through that, how best to make that connection happen.
Yeah, and it is interesting and to hear you bring up the diabetes prevention program and silver sneakers, because these are long established programs with good bodies of research behind them. And I think that seems like a big key to really propagating any of these other allied health professionals into the reimbursable physical activity spaces. Can we develop programs and actually have some type of validated metrics that show that, hey, much like the DPP or like silver sneakers, that we're actually producing the outcomes that are necessary to really justify reimbursement.
Mm-hmm. That's exactly right. Yeah, that's exactly right.
Yeah, I think it's an exciting time. I know I'm an exercise physiologist by trade, and it always really heartens me to hear that this work is going on. But as you said, doing this one person by one person at a time that's almost a no-win process. This has to be, how do we develop systems and collaborate together, much like you guys are doing with the PAA, to be able to make this such a much more broad initiative.
Yeah. No, I think that's absolutely right. We have to look at different ways of delivery. And I think COVID has pointed out some innovation areas And, whether it's group delivery, whether it's telehealth, asynchronous, synchronous delivery into homes, people's homes or communities, programming, and I think the use of mobile technologies to inspire people to be physically active, whether it's smartphones or watches, et cetera. So technology has a role here. And I think that's kind of neat about physical activity too, in that there's the opportunity for self-reported physical activity, but also more objectively measured by devices. The thing is that we've got to get the mobile technology industry, I think there's the opportunity for a powerful convening there to see if we can get to a standardized measure across devices, across algorithms that is reliable and validated, that could feed into the electronic health record too. So there's some work there that I think is really important for, and I think that's where the difference with physical activity is, there could be an objectively measured vital sign there, which is exciting.
Yeah, and when you talk about standardization, I think most people are familiar with the 10,000 steps per day, but then there's also the physical activity minutes and things like that. And although those are all good measures of physical activity, if we're going to really affect change on a large scale, some type of standardized measure is going to be important for this, and really honing in on that as objectively as we can would be a huge win for this type of research.
That's exactly right. Well, we know that, the need for an evidence-based measure that is reliable, valid, is really critical. So each of these companies has their own algorithm, their own proprietary measure, and that's great. But, is there a possibility to bring the industry together to at least, they could maintain their private, algorithms, but is there a way to have them also do a measure that is in line with the physical activity guidelines, evidence-based? That would be exciting. Standardize it across industry. I don't know, but it's hard. The proprietary nature of this work in industry, it's hard to overcome that. But I think if we could at least have the convenings, start the conversation, continue the conversation. This conversation has happened in the past. Progress is not, we haven't made much progress, but we know that a significant segment of the current devices don't have that evidence-based measure embedded within their algorithms. So at the American Heart Association, that's our top priority. We are all about the evidence base to make sure that whatever measure we have is informed by the science.
Yeah, absolutely.
And in line with the guidelines. Yeah.
I am actually keen to ask one question that kind of came up there as you were talking, which is on the data with regard to current physical activity levels in our country. I think you often hear this. There's a bunch of different statistics thrown around with varying degrees of support, but often you hear that somewhere around only about 50% of Americans-ish meet the 150 minute per week physical activity standard. You also hear that only 1 out of 4 Americans meet it for strength training and for aerobic activity. And there's a lot of confusion in the data set that's out there. My question is, since a lot of the data is self-reported, how accurate do you feel it is? And what do you get the sense of is the real physical activity status of our country?
So it's a great question. And I think we also have to consider physical activity status post-COVID. What we've heard initially, it seems like there might have been a negative impact of the pandemic on our physical activity levels. That will be verified as surveillance continues to come out. But I think, and so we do know the age-old difference between self-reported data and actually measured data. Self-reported data tends to be higher than actual. But there is still value in collecting that self-reported data, and of course, but I think the other thing we know is we're doing this communications project with Frameworks, and that was another thing that we were able to do this past fall, is unveil the first phase of that work. And Frameworks is helping us develop the message framing and research to create messaging, communication strategies that are most impactful when we talk to policymakers as we're trying to motivate policy systems, environment change around physical activity. And one thing that they found in this initial research is that people view physical activity as exercise. It has to be at the gym. It takes a lot of commitment. There's, and so there's a certain amount of inertia that has to be overcome to be physically active and make this a regular part of the day. And so I think we have this work ahead of us to create policy and systems changes that make it easier to surround people with environments, and policy that make it easier for them to walk safely, to bike safely, to roll in their communities in their leisure time or to and from work and school, et cetera. And so that's going to be continued important priorities of the Alliance. But I think it's also positioning physical activity for policymakers across the major issues that they're addressing right now and will be addressing post-pandemic, whether it's the opioid epidemic and substance abuse, climate, the health of our planet, race and social justice. We have to articulate the reason why activity and fitness should be part of those solutions. And that's another thing that we're working on at the Alliance.
Yeah, I think that's such a good point to actually realize that there are some higher level first order issues, I think, that our policymakers are trying to address. But physical activity does play a role in all of those things you mentioned, and being able to almost build that into some of that legislation could be a great way to advance our cause. I think I have a couple of action points for our listeners at the end when we get to that point. But I have to stop here to ask the critical question, which every physical activity expert is asked. And I know there's no perfect answer, but I have to ask it to you anyway. But nearly every American, in fact, I'd probably go as far as to say every American knows the benefits of physical activity. They do. Certainly, more research is good, but I don't know if it's necessary because people know the benefits. Yet very few people, or considerably fewer people than what we would want to be, are physically active. Why does that gap exist? What do you think?
Well, as I just said, as we were just talking, I think there's that inertia that people have to overcome or perceive that they have to overcome to be physically active. And so we have to, I think, change the messaging. We have to develop the right messaging to help motivate people, help people see the value in physical activity in their lives. And I think that value is, as you say, it's not the long-term value, but the short-term. What do they see in the short term that's part of that results from their physical activity? And I think, the National Physical Activity Plan, Michael, gives us a roadmap for implementing the physical activity guidelines across all the sectors. And so it's there, the roadmap is there. We just have to work across all levels of government, work across those various stakeholders. And I think build powerful private-public partnerships to do our work and create the urgency around physical activity. So I'm hoping we'll come out of I think we're I was on a panel, a couple of weeks ago with Fiona Bull and Ruth Peterson, and we were talking about, is this a landmark moment for physical activity? Is this a watershed moment? And we all agreed that it is, and we should try to take advantage of that we come out of this pandemic, people are seeing the effect of it on mental health, on physical health. And if we can't message physical activity in the context of this recovery, then we're going to have a missed chance here.
Yeah, and I definitely want to summarize, I think, two important themes that you brought up there, because I think it's critically important to mention them. One is there is an individual, a personal responsibility component to this, but tying that to more immediate rewards rather than some type of long-term benefit. I think we all know that exercise helps prevent heart disease, prevents diabetes, prevents stroke, but most people view that as, hey, that's 10, 20, 30 years down the road. But there are more proximal benefits to being physically active that I think that are important for us to start to message. And that sounds like a lot of what you're doing. But the other side of that coin is also setting the environment up properly in every level to try to make physical activity, the easy choice, and physical inactivity, the hard choice. So essentially, you're working both on the upstream and the downstream ends of the spectrum.
Mm-hmm. That's absolutely right. It's absolutely right. And so, that's why doing this all together is so important, because I think we have to leverage the ingenuity, the visions, the assets of the private sector with the public sector and public health. And I think, it's a little more challenging in the area of food and nutrition, because, there's this imperative on the nutrition side that, companies are trying to sell their foods, whether they're healthy or not. On the physical activity side, I feel like we're in a little better place where we all want to see the promotion of physical activity. And if people become more active, then we all are successful. And so I'd like to see more of these private-public partnerships.
Yeah, and I feel like COVID has really exemplified the amazing byproduct of a public-private partnership. I mean, there's no way that these vaccines are produced in the period of time that they were without that strong, private industry support. So hopefully that's just a springboard for what we're trying to do in the physical activity domain.
Yeah, that's absolutely right. I think we have to harness and work with the power of the private sector, and bringing what they can bring to this is just so incredibly powerful.
Yeah, and to get a little bit more into the Physical Activity Alliance and their framework, it seems like as I was reading about this and as we talk, there's three pillars. There's public advocacy, we've talked about that. There's strategic planning, we've touched on that a little bit, and then there's workforce development. Those are the three pillars. Mm-hmm. Could you maybe unpack those a little bit just so everybody understands a little bit more the different components that the PAA is actually working on right now?
Sure. So as you said, the National Physical Activity Plan is our strategic roadmap. And in my mind, and I've talked to Russ Pate about this and Bill Cole, who lead that work, that's the policy research foundation, the evidence base, the science, which, I've always working for the American Heart Association, we've prioritized, we're an evidence-based policymaking organization, the same for the Physical Activity Alliance. The National Physical Activity Plan is our evidence base, is the science, brings the experts together to inform our policy translation. And so then we connect the plan to the policy work of the policy committee. And then we have this really important work of professional development and connecting public health professionals across the country to this policy systems environment change prioritization. And so they become the important grassroots voices for this. Any successful advocacy campaign is going to have the policy lever, what you're trying to accomplish. It's going to have the policy research as the foundation for that. It's going to have media advocacy to put this out as the media, social media or traditional media. And then it's going to have grassroots voices who can talk to policymakers and say, this should be a priority for you, and then of course the lobbying and the work to educate policymakers, and all of that works together to make a campaign successful, whether it's in the legislative environment or the regulatory environment. So that's public policy. That's what we're focused on at the Alliance. But because we bring those three assets together under one umbrella, it hopefully makes us more successful in advancing physical activity across the population.
Yeah, absolutely. And the National Physical Activity Plan, I've read it. I think it's an amazing document and all of its iterations. And we'll link up to that in the show notes to this episode so people have the opportunity to look at it. As you said, I think I was struck, and you actually hit the nail right on the head. I was struck the first time I read that document, and I said to myself, I said, the roadmap is right here. Like it couldn't be any more clearly laid out. Now we just have to do the work with the policymakers, as you said, through legislation, but also is that grassroots part of the effort with those public health officials and other people just in private industry that are willing to champion this cause from the bottom up. So it really takes both ends of the continuum coming together to actually catalyze action.
That's absolutely right. That's right. That's why I'm a firm believer in kind of coming together to make extraordinary things happen. It takes that collaborative alliance.
Yeah, absolutely. And that's one of the main goals of this podcast is just to get the word out there. With that, there can't be collaboration without awareness. And hopefully this provides awareness to people that are in the health and wellness space to be able to get involved. And I'm curious because you're part of the Physical Activity Alliance. You do great work with the American Heart Association. I've personally been involved with the AHA for 5 years as a volunteer, and it's a very fulfilling experience. But you get to see a lot in the physical activity ecosystem, and that's exciting, and it comes through in your passion. But what are you seeing right now in particular that excites you so much about the potential for human well-being and flourishing based on all the things you're seeing?
I know it's an interesting time. First, Michael, thank you for all that you've done to support the American Heart Association and for our podcast today, supporting the Alliance. It is, we've already kind of touched on what makes me excited right now. We are at a critical time, a critical juncture as our country comes out of the pandemic, and we kind of, and I think we're going to be in a new normal, and we can help articulate what that new normal could look like for us across the country. And, any way that we can help position physical activity in the new normal would be fantastic. And I think there is commitment across private sector, government, to address these big issues around social justice, climate, and infrastructure. And there is potential for physical activity and fitness and health and well-being to be positioned in those conversations. I also think there is commitment from corporations within their own organizations. And so we talk about the big P public policy, but there's also the opportunity for the small p or organizational policy, where organization by organization, we can address social justice, climate, et cetera. And, whether it's hospital systems or, big companies, small companies, just making their environments healthy and, fostering physical activity within their employee populations, that's a huge start. And so I'm excited for how, I'm seeing corporations taking social responsibility to heart and engaging. They're being pressured, but they're now willing to engage in some of these big issues. And, groups like the National Business Group on Health are writing policy statements and for their members. And wow, that's pretty neat to see private sector commitment where it goes beyond earnings per share into contributing to the greater good. And that gives me hope. And if we can try to harness that together, I think that could help us move the needle.
Yeah, so it really, the thing that all seems to come back to is we're at an inflection point right now, you feel. And if we take advantage of that inflection point, this could really springboard us into a very different future than what we've seen with physical activity in the past.
That's my hope. I mean, I think it would be really great. And to make that have the privilege of helping to make that happen is really awesome.
Yeah, absolutely. If I'm somebody who's listening to this and maybe I'm not necessarily a physical activity researcher, maybe I'm in health or medicine or public health or some aspect of health sciences, and I want to get involved, what can I do to help make a difference in this cause? Because I suspect a lot of people listening will be very passionate about this and will want to do something, but not everyone can go lobby before Congress. So what can they do?
I would like to just put a plea out there that every person listening to this podcast is an advocate. And if they could commit to, within their community, within their organization, within their faith-based, within their faith-based organization, within their school system, to try to foster some change, to try to make something happen. I don't want everybody should feel the power of being an advocate, because they are and they can be. And every action that an individual takes toward this policy change, whether it's big P, but also the little p policy that we were just talking about, is huge. Every person's voice matters. And I think if everybody could consider it an obligation to talk to decision makers about the importance of prioritizing physical activity and fitness and all, the work that's being done in communities right now, in schools, as they come out of the pandemic, then everybody listening can make a difference. And I'd love for everybody to take that on and make that commitment.
Yeah, I think that's great. And it's so important. I know from a big P policy standpoint that legislators respond to the needs of their constituency. They always do. So reaching out to your representatives at the local and the state level and at the federal level, and just putting this on the radar, the more that they hear about this, the more likely it is to shift policy in a positive direction. And so I think that's critical. But I think the other thing that you said that can't be understated is all those little P policy changes, or just even the conversations you have with people to encourage them to get more active. I said earlier, our guideline for physical activity is 150 minutes per week, but you're an expert researcher in this area. Would you agree, and I actually said this to Cedric Bryant when I was talking to him as well, would you agree that there's a bigger health benefit conferred by going from 0 minutes of activity to 15 minutes of activity than there is from going from 135 to 150?
Yeah, the evidence is definitely showing us that that's the case. If we can reach those who are most sedentary and get them to the next level of physical activity, that's where we have the greatest bang for the buck. And so wonderful if we can try to make that happen. And I think, that's where our messaging comes in, is so important. How do you help support and motivate people who are currently not active at all into doing some level of physical activity? And, the Centers for Disease Control and Prevention has this goal of creating a social movement. It's called Active People, Healthy Nation. And they want to have 27 million people be more active by 2027. So let's all help create that social movement. Let's do that with the individual conversations we're having with our families, in our communities, in our schools, in our workplaces. And let's help make that movement happen. Every person who's passionate about physical activity can contribute to that. And I love the idea of one person at a time, or one group at a time, or one workplace at a time, we contribute to that social movement.
Yeah, absolutely. I think it is. Everyone can truly make a difference. And I think certainly what the PAA is doing and what you're doing at the AHA is making a difference. Where can people go if they want to find out more about you and your work at the AHA and the Physical Activity Alliance?
Well, certainly come to the American Heart Association's website. And if they're interested or get in touch with me personally, my email, hopefully we can make that available, Michael, to all those who are listening to the podcast. I would love to talk to you about ways that you could engage with us. With the Physical Activity Alliance, we've got a great tagline that our alliance manager came up with, Move With Us. And so our website is paamovewithus.org. So definitely go to the website, check us out. It's, we'd love to have you join the work that we're doing.
Absolutely. Yeah. And I will link up to all that in the show notes. And as an aside, from an AHA perspective, I could say the AHA has so many great programs in the communities around the country. I'm involved in the Heart Walk, which I feel that's the embodiment of the physical activity movement in the country. And supporting that cause has been very near and dear to my heart, and I think no pun intended. And I feel one of the things about the AHA that I like is that they fund research and policy work, certainly, but they also fund things in the community. The group that I'm involved with locally here in Washtenaw County around Ann Arbor, part of our fundraising is going to go to purchasing exercise equipment for underserved youth to be more physically active. And I think that it's not just that money's going to the national office, it's actually funding things locally. So I think definitely go to the PA's website. We'll link up to that. Go to the AHA's website, but also consider supporting the AHA in your local community because they are very intrinsically tied with this physical activity movement in our country.
Absolutely. We're providing the administrative backbone to the Physical Activity Alliance, the American Heart Association is, and we're just so appreciative, Michael, for, like I said, for the work that you're doing and others in the community to support the research that we're trying to fund and the programming and education. We're celebrating our 40th anniversary in AHA Advocacy this year. And so we've been working on policy and systems change for quite a long time at all levels of government, from local, state, federal, but also now global as well. And just connecting across all those levels of government and trying to affect change. But it's the work of, I know this working with our programs in schools, it is one student at a time. It's in the Heart Walk, it's one person or one company at a time that is contributing to this work together. And it makes a huge difference. And as you said, we're making that investment back in communities because we know the value of that, but also trying to affect this policy systems environment change across all levels of government is just, I feel privileged to wake up every morning and do the work that I do. And it is both personal and professional for me. And I feel very honored that I can work for an organization whose mission I am wholly invested in. And I know that that's not always the case in our work. And so I feel very humbled by having the opportunity to do that.
Well, I truly hope you enjoyed that conversation with Dr. Whitsel as much as I did. If you found it informative and insightful, please share with your friends and colleagues. Those shares really do make a difference. Before I sign off today, I really want to reiterate one thing. Advocacy is absolutely critical if we are going to proliferate our message and if the fitness and wellness industry and fitness and wellness practitioners are going to become part of the healthcare delivery system in this country. The squeaky wheel gets the grease, as they say, and politicians, lawmakers, anyone involved in politics or public policy, they respond to a large groundswell of voices and advocacy. One phone call to a legislator's office doesn't make much of a difference. 2 phone calls doesn't make much of a difference. But 100 phone calls, 1,000 phone calls, 1,000 letters, those make a difference. So if leaving this podcast, you've been a little bit more educated on the importance of a top-down policy-based approach to improving health and wellness and increasing activity levels in this country, I urge you to take the next step to figure out how to become an advocate in your local community, at the state level, and even at the federal level, if you're so inclined. This type of groundswell from a grassroots perspective can affect top-down policy. And if we can have an environment in our country that favors making the active choice, the healthy choice, the choice that takes us in a more positive direction from a wellness perspective, if we can have policies and infrastructure in place that allow those choices to be easier, and then the negative, unhealthy choices to be more difficult, we will see a dramatic and seismic shift in the health of our population. But it takes each and every one of us to be involved in that advocacy. It is something where one person can make a difference, provided we're all on the same page, speaking the same message. And I think Dr. Whitsel articulated that very, very well in the podcast. We will post a whole host of resources on the show notes page. That can be found at wellnessparadoxpod.com/episode 16. Please don't forget to be on the lookout for next week's episode when it drops on Wednesday. And don't forget to subscribe through your favorite podcast platform. Until we chat again, please be well.